my audience. Today we'll continue another talk about the brain anatomy, and it covers mainly the blood supply of the brain, including the arterial supply and venous drainage. The brain receives its arterial supply from two pairs of major vessels, the vertebral artery posteriorly, and this is the vertebral artery, and the anterior internal carotid artery anteriorly, which are interconnected in the cranial cavity to produce what we call the circle of Willis arterial network. This is the frontal diagram, simple to show the origin of the major vessels which supply the brain. The two vertebral arteries, the right and left, are paired structures which are originating from the proximal part of the subclavian artery on both sides. The left common carotid artery originates directly from the aortic arch, and the right common carotid artery originates from the right brachiocephalic trunk. The bifurcation of the common carotid artery, which we are concerned with, gives the origin of the internal carotid artery on the left and right, which is the main constituent of the anterior and middle brain arterial blood supply. Let's start with the internal carotid artery. It begins, as we said, by the bifurcation of the common carotid artery, and it perforates the base of the skull and passes through the carotid canal. It enters the middle cranial fossa beside dorsum silli, anatomical location. Then horizontally it moves in the cavernous sinus, emerges out in the medial side of the anterior clinoid process, perforates the dura and arachnoid matter, and enters the subarachnoid space. Turns posteriorly and upward and divides into the major two anterior and middle cerebral arteries. The vertebral artery is a branch, as we said, of the first part of the subclavian artery on both sides. It passes upward through the foramen transversalium from C6 to C1, enters through the foramen magnum, perforates the dura and arachnoid matter as well, and enters the subarachnoid space. Turns upward, forward, medially along the medulla oblongata and lower border of the pons, which joins the other side and gives the origin of the basilar artery. The constituent of the circle of Willis is both from the vertebral artery and its basilar and posterior cerebral artery branches, and the internal carotid artery on both sides with its branches of middle and anterior cerebral artery, and the anterior communicating artery, which originates from the anterior first part of the anterior cerebral artery, and the posterior communicating artery, which originate directly from the internal carotid artery, are also constitute of the circle of Willis. These are some of the major branches of the vertebral and internal carotid artery. Basilar is the uppermost final branch. Posterior cerebral arteries comes from the basilar artery tip. Pontine, labyrinthine, anterior, inferior cerebral artery, superior cerebellar and choroidal arteries. Internal carotid artery, anterior cerebral, middle cerebral, ophthalmic, and choroidal. And as we mentioned, the posterior communicating artery is originating from the internal carotid, and the anterior communicating artery from the first part of the anterior cerebral artery. This is the diagram which demonstrates the circle of Willis. This is the circle of Willis, and these are the anterior and middle and posterior constituent of it. Now we have a systematic diagram of the constituent of the blood supply of the brain and formation of the circuit of Phillips. We'll start by the vertebral arteries on both sides. This is the site of formation of the basilar artery by joining the two sides of the vertebral arteries at the lower part of the cones. This is the basilar artery. The basilar artery gives off the posterior cerebral arteries, right and left. Anteriorly, we have the left internal carotid artery and right internal carotid artery. Give branch to middle cerebral artery on both sides. And anterior cerebral artery, left and right, with the anterior communicating artery, which originates from the proximal A1 segment of the anterior cerebral artery, and is a very common site of aneurysm in the brain. Posterior communicating artery directly from the internal carotid artery and joins the posterior cerebral arteries. Sometimes there is what called infantile posterior communicating artery, congenital abnormality, which directly communicate with the posterior artery distal to P1 segment, which is almost hypoplastic or absent in this case. This is the posterior inferior cerebellar artery arising from the vertebral artery directly. This is anterior inferior cerebellar artery arising from the early segment of the basilar artery. And this is the superior cerebellar artery arising from the upper part of the basilar artery. Okay, this is the detailed diagram of the brain blood supply and distribution within the brain parenchyma lobar in regard to the major blood arterial supply. Let's again review that this is the internal carotid arteries on both sides. This is the left and this is the right. Let's take this one is the middle cerebral artery, which gives the M1 segment supply, as we see major part of the left cerebral hemisphere. M2 supply is rather distal, cortical and peripheral and anterior. This is of course the superior, and this is the inferior part of the middle cerebral artery supply. If we go to the anterior cerebral locks, it is in the parasagittal area of the cerebral cortex. Of course, if we deal with the major internal carotid artery on both sides as a whole without its divisions, it is responsible for a high area of supply. Suppose it is occluded, it will affect large hemispheric territory. These are also branches, lenticular striate, which are involving the lentiform nucleus, which includes the putamen and globus pallidus on either side. This is the thalamo-posterior, as we mentioned, part of the supply of the thalamus. And these are the anterior choroidal artery, supplying part of the internal capsule. And this is the posterior cerebral artery territory, as you see, supplying part of the thalamus and large area of the medial aspect of the occipital lobes. This is distribution of the posterior circulation. The ICA is anterior and lateral. The pica is most of the cerebellar hemisphere is supplied by the pica. Superior cerebellar, it is highest level compared to the pica. And these are the basilar artery for the pons. And this is the perforators which share in the medulla oblongata and pons supply. Now we'll come to the venous drainage of the brain. We'll demonstrate basically the major, deep and superficial and dural sinuses, and we'll come back to specific areas. We'll start by the great cerebral vein, vein of Galen. Vein of Galen, of course, receives tributaries from the internal cerebral vein and basal vein and drains into the straight sinus. On the opposite side, we have at the superior part of the brain, we have the superior cerebral veins, which are 10 to 15 veins in pairs on either side of the brain that supply the or tributary of the medial surface of the frontal and parietal lobes. These paired veins drain directly into the superior sagittal sinus. So we have the great cerebral vein draining into the straight sinus and the superior cerebral veins draining into the superior sagittal sinus. The superior sagittal sinus and the straight sinus both drain into the confluence of sinuses. On the opposite side, we have, of course, the inferior sagittal sinus, which is in the free edge of the sagittal or the falx, and it drains directly into the straight sinus and covers the medial aspect of the hemisphere. The confluence of the sinuses drains into the transverse sinuses, right and left, then into the sigmoid sinus, also right and left, which drains into the internal jugular veins, right and left. Here we mention the superior cerebral vein. Opposite deep structure is the middle cerebral vein. Middle cerebral vein is called the superficial sylvian vein and the deep sylvian vein, respectively. And it drains into the cavernous sinus, which through the superior petrosal sinus drains into the transverse sinus, and the inferior petrosal sinus drains into the internal jugular vein directly. This is the demonstration of the venous drainage of the brain. We have to mention the subarachnoid spaces in this talk. Why? Because all the mentioned arteries and veins are passing through the subarachnoid spaces, or cisterns as we say. It is by definition, it is an area within the subarachnoid space where the pia mater and arachnoid mater are not in close approximation. So they create what likes a abundant space filled with CSF as a pool and contains the major cerebral veins and arteries. We name them, as we said, cisterna magna, which is the cerebellomedullary cistern, and prepontine cistern, supracillar cistern, interpeduncular cistern, which is the site of the circle of Willis, quadrigeminal cistern and avian cistern posteriorly. The quadrigeminal cistern is the major cistern of the great cerebral vein, where we look for abnormalities like aneurysm of the great cerebral vein. Thank you for listening.